Imagine waking up 3,000 years ago with a head injury, and your best chance of surviving is with a surgeon in an ancient temple, home, or makeshift location. Luckily, you live in Egypt or the Americas, two civilizations. According to mainstream history, with no shared language, no trade routes, no contact, yet both learned how to open the human skull and their patients lived. In this video, we're comparing ancient Egyptian and pre-Columbian American medicine, surgery, plant science, dentistry, hygiene, public health, and birth care. Surgical suturing was documented in Egypt by the early 3rd millennium BCE. The Edwin Smith Papyrus documented 48 trauma cases using systematic observation. First, examine. Second, diagnose. 3. Prognose, and 4. Treat. This papyrus reads like a modern emergency room manual, minus the fluorescent lights and 3-hour wait times. Meanwhile, in the Americas, medical knowledge was preserved through codices, apprenticeship systems, and oral transmission among specialized healers. Indigenous Americans trained formally. They categorized illnesses by symptoms and causes, distinguishing physical trauma, infection, and spiritual imbalance. Skeletal remains in ancient America show widespread trepanation, which is careful drilling or scraping of holes into the skull to relieve pressure from trauma or swelling. High survival rates were between 75 and 83% on average, up to 91% in some periods, supported by analysis of Peruvian skulls. Ancient indigenous surgeons sutured with hair and plant fibers for centuries before European contact. Both cultures also used copper-based surgical tools. According to the Smith Papyrus, copper tools and compounds were used to treat wounds, which we now know can inhibit microbial growth. But here's the part that stops people cold. Many of the ancient skulls from both Kemet and America show clear bone regrowth, meaning they survived months and years after surgery. This wasn't ritual guessing, it was observation and trial and error, refinement across generations. Basically, peer review, with papyri and oral tradition instead of journals. In terms of naturopathic medicine, both civilizations used willow for pain relief. Willow bark is a natural pain reliever containing salicin, a compound like aspirin that helps reduce pain and inflammation for headaches, back pain, and arthritis. It is used by drinking brewed bark tea, taking liquid tinctures, or chewing the raw bark. Both cultures also used garlic for cardiovascular and immune support. Ancient Americans used it as a stimulant and to treat respiratory infections, digestive issues, and wounds. Kemetic use of garlic is explained in the Codex Ebers from 1500 BC. Beyond medicine, it was used to boost the stamina of laborers and was found in Tutankhamun's tomb. Kemetic literature cites honey in roughly 500 remedies for treating wounds, burns, infections, and digestive issues. Renowned for its antibacterial properties, it served as a primary wound dressing and was often mixed with ingredients like grease and lint to create salves. Ancient Americans also mixed honey with other substances to treat various ailments, including throat infections. On a personal note, I used Jimarito honey that surprisingly improved my ability to see fine print and helped my night driving. Bright, glaring car lights used to bother me so bad, but now, not so much. If you choose to try it, do your own research first. Get your doctor's opinion before trying any new treatments. Indigenous American healers used coca leaves that were integral to religious and social life. It was used for pain relief and stamina. It was also a nutritional aid. Chewed or brewed as tea, the leaves were used to treat hunger, fatigue, and pain. Only native to the Americas, somehow the plant made it to ancient Egypt. However controversial this finding may be in academia, scientists have indeed found traces of coca and nicotine, perhaps from tobacco, in the remains of Egyptian mummies. Tobacco was used topically for pain, infections, and respiratory issues. It served to heal wounds, treat skin conditions, and was considered a primary plant for cleansing and protection. Cannabis was also detected in the mummies. On the surface, this sounds like a wild time, but on a deeper level, altered consciousness through plants was used for spiritual healing, alignment, and communication with spirit. Ancient Egyptians extensively used various tree resins, including pine, for medicinal purposes, along with other aromatic resins like frankincense and myrrh. These resins were prized for their antimicrobial, antiseptic, and anti-inflammatory properties, making them essential for wound care, skin ointments, insect bites, and joint inflammation. Ancient Americans used pine resin to treat respiratory ailments such as coughs and asthma, often by inhaling fumes or applying as a chest salve. Both cultures identified antimicrobial, anti-inflammatory, analgesic, and stimulant compounds. That's pharmacology before the word existed. Concerning dentistry, ancient Kemites performed procedures including draining abscesses and splinting loose teeth with gold wire. Major ancient flex. Archaeological findings show they used gold wire and plates to stabilize loose teeth and fill cavities, showcasing advanced dental care. Additionally, they believed gold was a divine, immortal substance with, in some accounts, healing or rejuvenating properties. Skeletal remains in America also show dental modifications and evidence of treating abscesses. Indigenous groups adorned their teeth with jewels, gold, and other metals to signify high status. They even used herbal anesthetics before procedures. Both cultures understood something critical. First, that pain isn't random, it has causes, and it can be treated. And probably most importantly, invasive surgery should be done as a last resort. Regarding pregnancy and birth care, both cultures used plants in interesting ways. Kemetic medical papyri explained how pregnancy tests involved sprouting grains, included fertility treatments, and shared gynecological prescriptions. They diagnosed pregnancy and identified fetal gender by urinating daily on barley and wheat seeds, according to the Berlin and Carlsberg papyrus. If neither sprouted, the woman was not pregnant. If barley grew, it was a boy, and if wheat grew, a girl. This method held roughly 70% accuracy for confirming pregnancy, likely due to estrogen in urine stimulating seed growth. They also used the smell of garlic in a woman's vagina to check for fertility. Potions incorporated garlic, beer, and herbs to stimulate conception. Female treatments included fumigation, which involved smoking techniques to treat vaginal infections and promote fertility. When I first saw this, I thought, dang, fumigation? That's used to get rid of roaches and termites. Poor girl. Ladies and gentlemen, vetting your partners well never gets old. But women still use similar yoni steams today. Sometimes honey, oil, and herbs were mixed to make medicated tampons to improve reproductive health. Both cultures sometimes used honey concoctions as a form of contraception. Indigenous American midwives used herbal induction agents, massage techniques, sweat baths, and postpartum recovery rituals. They used herbal agents such as blue cohosh and wild cherry bark as teas or tinctures to induce labor, stimulate contractions, and aid in delivery. These botanical medicines were carefully administered to manage long or difficult labors. Often, these practices were part of a holistic approach to pregnancy, including spiritual preparations. Every birth was both a medical event and a community responsibility, not something you left to chance and crossed fingers. As we discussed in a prior episode, both cultures believed illnesses had spiritual causes. Both civilizations utilized altered states to treat what we might now call trauma or psychological distress. Kemetic healing temples associated with deities like Imhotep combined ritual and remedy. In the Americas, healing ceremonies integrated chant, plant medicine, and breathwork. Modern medicine is only now rediscovering what they already practiced. Mind and body are not separate systems. For hygiene and public health, Kemites bathed frequently, used natron salts, shaved body hair, and emphasized wound cleanliness. In cities like Tenochtitlan, European observers were stunned by daily bathing habits and organized sanitation systems. Markets had cleanliness regulations. Aqueducts supplied fresh water. Ancient Kemetic and American cultures linked cleanliness with health long before germ theory. They knew dirty wounds killed people. So what does all of this mean? When two civilizations separated by thousands of miles develop antimicrobial wound care, identify natural painkillers, formalize medical training, practice dentistry, manage childbirth with structured knowledge, create public sanitation systems, and combine mental, spiritual, and physical health approaches, we're not looking at coincidence. These two civilizations were clearly linked, in my humble opinion, as most cultures on the globe were not up on the same game. These weren't lucky guesses or primitive rituals. Both cultures developed empirical, observational medicine, watching what worked, discarding what didn't, and passing knowledge through structured systems, temples, oral tradition, codices, papyri. So here are some questions worth sitting with. What does it say about human intelligence that two allegedly disconnected civilizations solved the same surgical problems using the same underlying logic? If honey-based wound care and trepanation were discovered independently twice, how many other ancient treatments are we missing or dismissing that may have been right all along? And perhaps most provocatively, if ancient healers arrived at the same conclusions, how much of modern medicine have we genuinely invented, and how much have we rediscovered with better branding and Latin names assigned from people who had to be taught to simply bathe? Lastly, considering the advancements our ancestors made, what kept them from crossing an ocean to meet and share knowledge with each other? Even more controversial, did the original Americans take their knowledge and skill to Kemet, considering that cosmically aligned American mounds are older than those in Egypt? Are the Great Pyramids just more advanced versions of mounds, or vice versa? Just speculating. Drop your thoughts below. While you're at it, which ancient practice would you try on your own? The Kemetic pregnancy test? Honey to disinfect? Skull drilling? Hopefully not. Whatever you do, check with your physician. Although sources are in the description, this video is definitely not providing medical advice. Anyway, thanks for watching. Check out these videos to see more commonalities between ancient Kemites and Americans. Until next time, stay in your Sekret power.